Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day, good evening, good morning, wherever you are in the world. You're probably streaming live, and that is if you're watching us on www.hilaal.tv. This is your health and wellness show. I'm Gouwah Solomon. Stay with me for the next 60 minutes or so, just under, as we discuss the topic of obesity. Yes, being overweight. People call you chubby, people call you, they look at you strange, and maybe you've picked up some extra kilos. And this is to the extreme extent, rather. Online, we have Dr. Ibrahim Mansoor, who is passionate about obesity, and that's what we'll be talking about. Don't forget to interact with us. You can WhatsApp us and on our various social pages as well. Stay tuned, because this might be of interest not just for now, but later. And it is also information that on a medical side, and also to the layman to understand what obesity is all about. But we have a specialist general surgeon online with us, Dr. Ibrahim Mansoor. Assalamu alaikum to you, Dr. Mansoor. Hello, Dr. Mansoor.
Wa alaikum assalam wa rahmatullah. Thanks for having me. Hi, can you hear me?
Yes, we can. I think there is just a little bit of delay, but we're all good. We can see you. Thank you so much for joining us today, Dr. Ibrahim Mansoor. This is your passion. This is something that you love talking about. This is within your field. As a specialist general surgeon based out in Durban. Tell us exactly the topic of obesity, being overweight. What is because of course that is to the extreme extent. Just to the layman understand, why is this term used, and what is the general meaning of it?
Yeah, I think the word obesity has been very loosely applied over the years. Essentially, we're talking about somebody who's heavier in terms of their body weight than they should be. If you want specifics, in terms of the WHO classification, the World Health Organization classification, you're using a body mass index of 30 and above. Body mass index is a crude indicator. It only takes into consideration the patient's weight in kilograms and the patient's height in meters, and index is calculated. And if it's over 30, that means that you are obese. Then there are different grades of obesity, so from a BMI of 30, and as you go upwards, there's different grades of obesity. There's morbid obesity, supermorbid obesity, etc. And essentially what that means is, as your BMI increases, your risk of cardiovascular effects and events also increases. I think, BMI has been significantly criticized over the years. It is not an all-inclusive assessment of somebody's health or their weight, but it's commonly used. And the reason we continue to use it is because the topic of obesity is complex. Classification, diagnosis of obesity is somewhat complex. And we need a simple common language or common reference point internationally, in health circles and amongst medical professionals, that we can reference. And that's why the BMI is so popular. But other than that, obesity is a chronic, intractable, relapsing issue. And basically, if you struggle with a weight problem, it is likely that you will struggle with a weight problem throughout your lifespan, and often in cycles. So you'll have, your weight will go up, you'll try and do something about it, and your weight will go up again, you'll try and do something about it. That's what we regard to as cycling. But as I said, the diagnosis and the definition of obesity is so in-depth that we actually use registered dietitians to do, full assessments on patients, looking at a variety of parameters, including their skin fold thickness, their body fat percentages, and a whole host of other parameters. I hope that answers your question.
Yes, it does. Thank you so much. Like you said, it is quite a varied explanation. But understanding the body mass index, the BMI, and also one's bone structure, is that two different weight measurements? And does one take that into consideration when doing the full weight measurements?
Yeah, as I mentioned, the body mass index is a very, very crude indicator, because it only takes your weight and your height into consideration. So basically, you could be a very have quite a a significant stature, you could be tall, could be very muscular, and therefore your weight would go up, and therefore your body mass index also would go up. But that doesn't necessarily signify that you are, extremely unhealthy or that your body fat percentage is up, etc. So, as I said, in most instances, if you look at everybody across the population, body mass index is probably applicable from that sense because it's easy to apply for something that's extremely complex. So yes, there are varying issues in terms of stature and how much muscle someone carries and a whole host of other parameters. But yeah, BMI is basically it's just a simple indicator.
Let's look at the diagnosis. You've mentioned the dietitian. Does the dietitian just play a role at the beginning? When exactly is obesity diagnosed? At what age? And when you said it does become a problem when it's recurring, you're just not something you're going to get over, or you can kind of help yourself with. Let's talk about the age categories of obesity and when it does become a problem, and once diagnosis is done, the process of that.
Obesity is not particular to any age. Obesity is applicable to any age group. So it's not only adults. In fact, we have a significant percentage of childhood and adolescent obesity. In fact, we've started to actually provide bariatric surgery or surgery for children that are quite young as 13 years old and 14 years old. So essentially, what we are saying is that obesity is obesity. The problem is such whether you're 9 years old or whether you're 90 years old.
Okay.
And, it's important for you to make that diagnosis, to recognize that there's a problem, recognize that you have to do something about it immediately. Because if you allow a 13-year-old, little girl whose BMI is already 50, for example, to progress, that weight is only going to go up. And by the time that kid actually reaches 20 years of age, she may already have established complications of obesity, diabetes, etc. And then it's too late. So you have to recognize it early, whether it's, as I said, whether it's childhood or whether it's adulthood. And that's why there's so much of awareness around. And, especially with the children, we need awareness amongst the parents and willingness among the parents to, bring their kids in. I think the chronic problem over the years is that obesity has had a lot of stigmata around it and a stigma around it. And actually, parents will say, "Oh, leave my kid alone. My kid is just chubby, or my kid is healthy, etc." It's the opposite. The child is extremely unhealthy and you should do something about it. So, to answer your question simply, it's something that can happen at any age group. And yes, it's important to detect it early. Your starting point would be at least your general practitioner, and then they can then involve your endocrinologist, your surgeon, your dietitian, etc. The role of the dietitian in obesity practice, in bariatric practice, in the treatment of obesity is, I cannot emphasize how important they are. Whilst obesity, the causes are manifold, a healthy lifestyle is core to it. So, and I think core to the lifestyle changes is actually what we call healthy and mindful eating. So, dietitian's role is excessively important, whether it's a child or whether it's an adult.
Yeah, make some changes. We discuss the stats and how you can make and implement that with a specialist surgical's Dr. Ibrahim, general surgeon rather, Dr. Ibrahim Mansoor. We have to take a quick break, Dr. Mansoor. Stay with us as we discuss this very pertinent topic of obesity. Don't go anywhere. Welcome back. Assalamu alaikum wa rahmatullahi wa barakatuh. Obesity, being obese and somewhat excessively overweight is what we're talking about. We have specialist general surgeon in studio, online with us rather, from Durban, based out at beautiful Blue Waters. And remember, you can also watch us live stream. Tell your family, friends and colleagues on www.hilaal.tv. Dr. Ibrahim Mansoor, assalamu alaikum and welcome back.
Alaikum salam.
So you go under a specialist as a specialist general and minimal access surgeon. Just explain that to us quickly.
So general surgery covers a wide spectrum of diseases. We cover basically soft tissue work, like soft tissue infections and tumors. Soft tissue meaning of the skin and the underlying structures, not bone. Thyroid disease, breast disease, hernias, and a significant proportion of our work is basically gastrointestinal work and hepatobiliary work. That means liver, gallbladder, bile ducts, and the whole intestinal system. So minimal access simply means that, a significant percentage of our work and surgeries are done via keyholes, little cuts, mostly on the abdominal wall, and, with the avoidance of making big cuts like we used to before.
So, Dr. Mansoor, are you passionate about fighting obesity? Why is that?
I think if you look at the national and the international statistics, well, we don't have so much of a registry in South Africa to document what our obesity problem is, but obesity is a significant health concern on a global scale. In fact, it's one of the uppermost main health issues. If you're looking at South Africa within the context of the world, we're probably the most obese country in Africa.
Sure.
And we probably rank somewhere around 3rd or 4th internationally. So we have a significant obesity problem in South Africa. And I think this problem has been left unattended to for a long time. And certainly we are trying to speak about it, and we are trying to create significant awareness in terms of the fact that people need to come forward and, firstly recognize the issue and feel free to access obesity services, because this is what we want. We want a leaner, healthier society, because certainly that will make for a more productive society.
Just taking that stats into consideration, what are the current rates looking at with these bariatric and the necessity for this type of surgery compared to 10 years ago?
It's a complex question. I'll tell you why. I think the obesity statistics have always been high. That's the first thing. The second thing is that no doubt the obesity incidence and statistics are increasing, not only in South Africa, but also internationally. The third issue was that we recommended interventions, especially bariatric surgery, when the BMI was at a BMI of 40 and a BMI of 35 with comorbidities. So if you had BMI of 35 with high blood pressure, diabetes, etc., then obviously that would classify as somebody who needed some intervention in terms of a surgical procedure. Having said that, if you look at the 2022 guidelines, the BMI criteria for bariatric surgery has actually gone lower to a BMI of 35 without comorbidity. So basically, just based on your body mass index, you can qualify for surgery. But we've alluded to the fact that the BMI is a very crude indicator right at the get-go. And if you're looking at obesity as such with a BMI of 30 and above, and we know that once your weight starts to increase, the natural history is that it will continue to increase. So we've thought for a long time, why would we wait for your weight to go up before we provide a solution for you? So I can tell you we've actually become more lenient in terms of offering surgery. And we've already operated on patients who've had a BMI of 30, 31, 33, etc. So certainly the the boundaries or the barriers to entry for weight loss services have come lower. The thresholds have been reduced, and I certainly foresee, and if the last 2 or 3 years are anything to go by, amidst COVID and everything, patients are seeking out services, and certainly with an increasing incidence. So more and more people will come through, and more people will be helped in the future. There's no doubt about
Has
that.
COVID had an impact on this condition?
Yeah, significant impact on the condition. Actually, we've seen that the obesity rates have gone up. People who are confined to their homes, taking in excess calories, unable to go to the gym, unable to work outside the house, unable to go for walks, etc. And the COVID issue has significantly impacted the obesity crisis in terms of people who were not obese are now obese. People who were obese are now worse off. And we're hoping that now that the pandemic has settled, that those things will adjust themselves in the coming years. I think even from a COVID and obesity perspective, in the midst or the height of the pandemic, we noted that the poor results were actually coming from obese patients. So it actually impacted them in that way as well. So certainly a very intimate relationship between COVID and obesity.
Is that recovering somewhat now, Dr. Mansoor?
I think so. I think obesity is going to be obesity, and if the pre-COVID trends are anything to go by, the incidence is gonna continue to increase. And a significant problem of that is actually that there's still a lack of awareness. Life has become easier in terms of accessing junk and processed food. You can place orders on an app, and you don't even have to leave your house, and somebody knocks on your door with food, and they can do that several times a day, 7 days of the week. So as technology advances, as the world progresses, people are becoming lazier, and I think the tide is only going to change. It's only going to change when we significantly impact the awareness space in terms of the fact that, guys, hold on, this is wrong, and this is dangerous, and something has to change, and it has to change immediately.
Okay, so last week, alhamdulillah, we had a show on hydration and good lunch boxes to carry, because often we as adults, as parents, we try and pack great lunch boxes and try and make it exciting for the kids, but we often forget about ourselves as well. Then we decide to go on a diet and some extra meal plans, but we don't always include the family. Hydration has been a big issue with the weather recently, the very hot days, humid days as well. Let's talk about some of the things that we can start implementing when it does come to daily eating plans. And often we talk about the word diet, and there's such negative connotation to it.
The issue about diets, if you actually search the scientific literature, diets are actually notorious for not being very good anti-obesity interventions. We have a wide spectrum of patients who need to lose weight. Patients will need to lose just a couple of kilograms. And then you have patients who need to lose 50 kilos, 80 kilos, 100 kilos, 120 kilos. For example. So if you're looking at the lower spectrum, somebody who needs to lose a few kilos, yes, you can be a little bit mindful with your eating, and you can exercise a little bit, and that should adjust itself. But anything more than that, you're going to struggle. I think, diets over the years have been notorious in terms of causing weight cycling, because these diets are so drastic that any living person in this real world cannot maintain and sustain that throughout their lifespan, and therefore they relapse. So they'll lose a whole lot of weight, whether you go on a keto diet or a low-fat diet, or there's several different diets and given different names out there, but they're actually not very good. In terms of diet and nutrition, essentially what we're going for is healthy and mindful eating. We want people eating less overall. We just want a reduced intake of calories. We want less sugar. We want less carb. We want less fat and processed foods. We want less junk food. We actually want people to have more chicken and fish. Preparation is important in terms of grilled rather than fried. We want people to eat home food, and we want people to take in a significant amount of fruit and vegetables, and that's what we refer to as mindful eating. And if you eat correctly, you will realize that you can actually eat a significant amount of healthy food on a daily basis, and you wouldn't have a weight problem. Saying, I think with nutrition, what we're really going for is less calories. We want people to take in less food on a daily basis. We want less carb. We want low sugar, low fat, and we just want, a healthier intake, less processed food and junk food. We want people eating at home. Chicken, fish, preparation is important in terms of grilled versus fried. And we want people to have more fruit and vegetables in their diet. And I think from the liquid point of view, because you mentioned the issue about hydration, yes, we want people well hydrated, but it is excessively easy to take in a high calorie diet with fluids and sugary and fizzy drinks, etc. we should avoid. Essentially, our bodies were just made for the intake of water, and we obviously need to hydrate as much as possible. I think the issue about food is important because it's highly complex. It's not just about what you eat, but it's about how you eat and how much you eat, and a whole host of other issues. And we need to start creating this culture within the household. It's not something that you just pack in lunches. There's no point packing an apple in a lunchbox and giving the kid 50 rand, and they go to the tuck shop in school and buy junk food, or come home after school and then there's junk food available at home, or there's a pizza for supper, for example. So this is something that affects us all. It's something that affects the entire family. And you just need to make good choices, especially in terms of even the groceries that you buy and you bring into the house, and the type of meals that you're preparing at home. So yeah, those are just some of the points that I can share with you in terms of the nutritional aspects.
We'll continue that conversation after the short break. Ramadan's also coming up, and how we can prepare early to get our goals and start, and some of the sunnah practices that we can, implement. We're speaking to specialist general surgeon Dr. Ibrahim Mansoor online about obesity. Don't go anywhere. Welcome back. A very good day to you. Good evening, good afternoon, wherever you are. Assalamu alaikum. This is Your Health and Wellness Show. I'm Gouwah Solomon. 2 more segments we got to get through halfway, and we're chatting to specialist general surgeon based out in KwaZulu-Natal, Central Durban, online, who has a passion for obesity and fighting obesity. And we heard earlier on that it does start with you making that lifestyle changes in your home. So Dr. Mansoor, you still with us? Let's check in. Okay,
yes, I am.
There we go.
Thank you.
All right, so let's discuss, the culture within the Muslim community, and how, everything revolves around food. We love eating, and we just talk about food smiles come about, and there's excitement. We also have the beautiful month of Ramadan, and we have some beautiful just practices within Islam to allow us not to get to that point of being obese. Talk to us about starting now. If you feel that you are in a situation of possibly being obese, or you are already in that state, how Ramadan and fasting and being in that state can help you making changes now and planning it.
No, I think in Ramadan, everybody thinks about the spiritual aspects, as they should. But I think Ramadan is an important time for you to just take stock of your entire life, especially the physical aspects in terms of your health as well. Because Ramadan is actually a time of reflection and introspection in all aspects of your life. Remember, our bodies were given to us as a gift from the Almighty, and as such, it is actually religiously or Islamically incumbent on us to try and take the best care of our bodies that we possibly can. You in Ramadan, you'll find that two things will generally happen to people. You'll get that group of patients who, or get that group of people who will tell you that in Ramadan, I tend to lose a lot of weight. And then you'll have another group of people who will say that routinely in Ramadan, I pick up weight because my metabolism is slower, etc., etc. And we hear all of the other excuses in Ramadan for picking up weight. I think the thing is that we just need to get our heads screwed on correctly, because it's not like we are starving throughout the month. We are having sehri in the morning and we are having iftar in the evening, and people tend to overeat, and there's a problem of ingesting too much of high calorie foods because you're not eating during the day, etc. So I think the important thing is to make sure that you are well hydrated, whether it's at iftar time and sehri time. And whether it's at iftar or sehri, it's important for you to eat healthily throughout the month, as it is important for you to eat healthily during the other 11 months of the year. So people have this idea that, I've been, fasting the entire day. I need to treat myself. I deserve this dessert or, the samosa or whatever it is. And unfortunately, there's an intake of grubby stuff and, oily stuff and carbs and refined sugars, etc. So you'll find that those people tend to pick up weight in Ramadan. But the people who eat generally mindfully and healthily will, because they're probably cutting down the overall calories in a day, lose weight in Ramadan. So I think it's important to just be mindful of those varying aspects. Exercise is important. People think that because you're fasting, you can't exercise. And remember, when we say exercise or we mean activity, we're not just talking about going to the gym. We're talking about just staying active in every aspect of your life. If you're at work, take the stairs instead of the lift. It's just those little things that will help you to burn off some calories during the course of the day. And we need to just get into this thing of where we are generally active people. I have to say, myself included, and the way life is progressing, it's difficult to go to the gym every single day of your life. It's just not practical to do so. So you have to incorporate these little minor changes that cumulatively come together to just add benefit to your health. I think the other point in Ramadan that I want to mention is the intake of dates. And while dates are extremely good from a health point of view, it's from sunnah practice, etc., etc. I think the idea of anything that you take in is not to overindulge. There's a lot of sugar. There's a lot of sugar in dates, and you find that people go through a significant intake of dates in Ramadan. And actually, not too long ago, there was a publication from the Middle East looking at how a high intake of dates could result in people picking up weight after having bariatric surgical procedures. So it's not something, it's not something that we should take lightly. We're not saying that dates are bad. We understand all the benefits of dates, but I think the key word here is just moderation and responsibility. Have a moderate approach and just be responsible in everything that you put in your mouth.
Thank you for that messages, Dr. Ibrahim. Let's move on to childhood obesity, how it affects a child, and if he or she is diagnosed with it. Are there possible genders to watch out for, signs to look out for when your child is on the borderline of obese, and how it does affect their life?
I think obesity in general affects a patient's life significantly in every aspect, whether it's the physical aspects or the mental aspects. Unfortunately, with children, we see the mental aspects even more. The body image issues, self-confidence issues. It's actually devastating for a child to be obese, especially because they lack the emotional and the mental maturity to fully understand what's going on. And in most instances, the parents are to I don't like to use the word blame, but they significantly responsible for the problem. You'll find that a significant portion or percentage of obese adolescents or obese children come from what I call obese households, where you'll find that the other siblings are obese, the mother is obese, the father is obese, and it's just because they've inculcated just bad lifestyle issues,
Yeah.
or there's a significant genetic component or metabolic component to this whole thing that runs within the family. So it really affects, their outlook on life. They, cannot buy clothes from a normal children's clothing store. They
Yeah.
have to buy adult clothes, or they have to make tailor-made
Yes.
clothes.
Yes.
They go to wearing cloaks or kurtas because they are more accommodating in terms of their body weight. They have resources available to them, but they cannot, go to any shop to buy clothes. They cannot do things like the other friends do, running around, just sports, going to the playground, etc. And that really plays on their minds over a significant period of time. And especially when we undertake obesity services for these patients, the psychological aspect of this we see is significant, and we put in a lot of effort to get the psychologist involved, not only with the
Okay.
child before offering surgery, but also with the parents.
Let's talk about, how the long-term effects can possibly harm that child. Is that at all a factor?
Yeah, I think so. As I made this comment right at the get-go, that obesity is a progressive, relapsing, intractable problem. And this is something that's not going to leave you easily. It's something that you have to do something about. You have to do something about it urgently. It's a significant health matter. And if you allow obesity to progress, you are allowing physical and mental issues to worsen. And once you end up with comorbidities, and you end up with actually complications from those comorbidities, we will likely see patients in their early 20s who have significant cardiac disease, coronary artery disease, who are significantly poor, type 2 diabetic patients
Yeah.
who already have end organ damage from their diabetes. They have significant joint damage from osteoarthritis, and early in their 20s they're starting to have joint replacements, etc. So
Sure.
this is not an issue that we need to take lightly. If
Yeah.
you think that if a child has more time on the side to treat obesity than an adult does, you're sorely mistaken. It's something that has to be taken, not even with the same seriousness that we have in adults, but actually more so.
Even more. Yeah. Agreed. Absolutely. So just some advice, and you said not to mention the word blame. But it is the responsibility of the parents. How can they, little bit at a time, start, making changes, and also their eating habits? Does that affect the child, on a daily basis? And to start now, just some ideas.
I think that the most difficult thing in terms of accessing obesity services is that patients have this idea of hopelessness. They feel, "Oh, I'm obese. There's nothing I can
Yeah.
do. This is my life. I just have to accept it, etc., etc." There are certain issues with regards to this. I think the first issue to mention is the fact that we have several evidence-based obesity treatments and interventions that are available to us in our armamentarium. So certainly nobody should be hopeless anymore in terms of being able to access care for obesity. That's the first issue. The second issue is a funding issue. Unfortunately, a lot of obesity treatments are pricey, and not everybody can afford it.
Yeah.
And
Yeah.
unfortunately, a significant portion of medical aids, in fact, the vast majority of them, are actually not funding, obesity treatments. The issue with the medical aids, we get this query often, is that can't you motivate, etc., to the medical schemes? The medical schemes are actually just funders, and they don't have a personal or a vested interest in anybody's health as such. And if you're looking at criteria now to access obesity treatments, not only surgery, but other obesity treatments in terms of medical treatments, etc. And if you take into consideration our high incidence of obesity in this country, almost every second or third person walking on the street is going to qualify for something. So the schemes are doing the mathematics here and thinking it's not really financially viable for us, but how does that affect our society and our health and our obesity burden? So these are some of the issues that are at play in the obesity sphere, or the obesity environment at the moment. The simple advices that I can give people is to not be hopeless. Educate yourself about, obesity, about healthy nutrition. There's a ton of good information that's freely available on the internet. Start by educating yourself and start by making small changes in your life. If you are 20 years old or 40 years old or 50 years old, it's taken you that long to become obese and put yourself in this position. Don't expect drastic changes in 3 months or 6 months, but start your journey, start with minor changes. And I think everybody, when they decide they want to lose weight, they go to the other extreme. They want to spend 5 hours in the gym. They want to go 7 days of the week, and they cut the intake down significantly. They don't want to eat any chocolate cake anymore. It's ridiculous. It's not practical. It's never going to work. Yeah, and what you do on a daily basis is essentially what's going to benefit you, not that one thing that you do every 6 months, for example. So I think the simple message is educate yourself, make small changes in yourself and within your household. Speak about obesity and speak about it freely. It is a significant health concern in South Africa at the moment. And I think the last message that I want to put forward to you is to not think that every doctor or every medical professional knows about obesity. Obesity is a very niche and very specialized subdiscipline where there's a few people who truly understand what obesity is, how to guide patients in terms of getting their weight down, and actually giving people the correct advice.
Absolutely.
Those would be few of the comments.
Absolutely agreed. We need to educate ourselves constantly, and baby steps. Even if it's sugar that you're reducing today, start that. We take more of questions with Dr. Ibrahim Mansoor and look into bariatric surgery and some of these diet medications, some quick fixes that people are often, aiding themselves for instead of actually making some lifestyle changes. We talk more just after this on obesity. Don't go anywhere. Welcome back. Assalamu alaikum. Very good evening to you, and thank you so much for staying with us as we discuss the topic of obesity. Being obese, a little bit overweight, changing your meal plan is what we're discussing and some of the solutions around that. We have a specialist, a general surgeon online with us from KwaZulu-Natal, Central Durban, advising us as he has a great passion for this on this subject, and we understand that it is a conversation that needs to be had everywhere, every day, just to stop it, and also that if you can see the signs that this is not a feared talk to have, because often there are lots of emotions around it. So let's get that conversation going and start with the small baby steps. Dr. Ibrahim, if I could just quickly move on to some of the factors that does affect individuals when it comes to obesity. We see the PCOS rate quite high, fertility more than usual. Young people are often suffering. Young couples are struggling to have babies. I don't know if cancer has a play in obesity. Please just take us through some of the unfortunate implications that surrounds obesity, and also, is it hereditary?
Yeah, I think that's an important question. Obesity is actually multifactorial. So you have the lifestyle issues in terms of the fact that people are very inactive. Activity is one issue, and then the other thing is the intake. So poor nutrition, poor diet, etc. Then you have other factors like medical factors. So a significant portion of medical factors are sort of intertwined with obesity. The most common ones that come about often are the thyroid issues, hypothyroidism, and the other issue is PCOS. Certainly, PCOS patients, a lot of them are on the obese or the overweight side, and you'll find that cardinal to the treatment of actually PCOS at the moment is actually losing weight, is to get your weight down. And for those ladies who are struggling to have kids whose weight is high, or they have an obesity problem, when you go to your gynecologist or your obstetrician, the first thing they tell you is to lose weight. But it's easier said than done. So yes, medical issues do play a role, and there are certain metabolic issues at play and also genetic issues. But in the course of all of this, sometimes it's difficult to pinpoint which exact issue is troubling the patient, because, as I mentioned, obesity is multifactorial, and most often we see that it's not just one issue, but a variety of issues that actually come together to make a patient obese. Um, that leads us on to the fact that if it is multifactorial, there are some things that you will be able to do something about, what we call the modifiable factors, and some things that you will not be able to do about the unmodifiable or the non-modifiable factors. Like, for example, somebody's genetics, or if there's a hereditary base, it's very difficult to be able to modify your genetics now. But certainly you can treat your medical conditions appropriately, you can exercise, you can eat well, and certainly if you're still having an obesity problem, you still have access to a wide variety of medical issues. The issue about malignancies or cancers that you spoke about, it is established, and there is a significant and a intimate relationship between cancers and obesity, in that obese patients are at a significant established risk of developing a wide variety of malignancies. So yes, obesity is a risk factor for cancer. I won't go into the various cancers. We don't have the time. But yes, there is an established relationship here.
So quick fixes, people, and we are inundated with diet medications, patches, yes, of course, training and getting physical is a big part of losing weight. But the quick fixes, diet and medication, let's look at that. And what do they actually do? How do they work? And are they even recommended?
Well, I think let me answer it like this. I'll just take you through what we call the treatment pyramid for obesity, because that'll encompass everything that you asked me about. So essentially, what we're saying is patients who need to lose weight, patients need to lose a few kilos, and then you have patients across the entire spectrum who need to lose more kilos. And you need to be able to access an intervention that will have the adequate treatment potency for your weight loss requirements. For example, if somebody needs to lose 80 kilos, you're not going to tell them go to the gym and exercise, because statistically that patient is going to fail. They need something more than that. Having said that, every obesity treatment is underlined by good lifestyle choices. So I'm not saying don't eat properly and don't go to the gym if you need to lose 80 kilos. You have to, whether you need to lose 3 kilos or 80 kilos or 120 kilos or 150 kilos, that is the fundamental, and it is imperative that you eat well. Whether you have surgery, whether you take medication, whatever it is, you need to be as active as possible, and you need to eat healthily and mindfully. So I hope that comes through. The second issue, or the second point that I want to bring to you, is the fact that there are no quick fixes with as far as obesity is concerned. There are only legitimate treatments and legitimate adjuncts. So basically what we're saying is that the obesity problem is not curable, but we have legitimate evidence-based scientific treatments that will make your mountain a molehill. We will get you to your starting point, so that your necessary lifestyle adjustments will then help you to be healthy throughout your entire lifespan. So there's a lot of gimmicky stuff out there, because the obesity incidence is so high. Industry and commercialism will take over and say, well, try this drop and this liquid and this patch and a whole host of other actually nonsensical and non-evidence based treatments. So I would suggest get opinion from the correct people, from people who actually are skilled and understand obesity. and have a good reputation for providing anti-obesity services. So that's important to bring to your notice. To just clarify the issue about evidence-based and non-evidence-based treatment, evidence-based treatments is that treatments that have been extensively studied, they are proven to benefit somebody, and we know all about the complication rates, the side effect rates, etc., etc. Remember, life is not so perfect where you can get something without a downside or without disadvantages in terms of side effects and complications. It is our responsibility as professionals to guide you through all of that so that you get the maximum benefit with the least amount of side effects and complications.
Dr. Ibrahim,
So
unfortunately, our time is running up. We've got a minute and a half to wrap up. Just let's look at some of the solutions and the bariatric surgeries, the type.
So you have right
right
at the bottom, you have lifestyle changes, and then above that you have medication. So some of the medications are around. You would have heard of Saxenda and Ozempic. They are good medications. They have been abused. There's a role for them. Seek advice from your professional. Not everybody needs to be on them. Then you have endoscopic stuff where it's non-surgical. They done as outpatient procedures. The most common one is an intragastric balloon, which is put via the mouth into the stomach for a 6-month period that will get you in the average range of about 15 to 20 kilos loss. And then after that, you have surgery, which is actually the king of weight loss services. But for people that meet the criteria for surgery and who have exhausted all non-surgical options for weight loss, and that's what we call bariatric surgery. Bariatric surgery is actually an umbrella term, and there's a whole host of procedures. So obviously your surgeon or your bariatric surgeon will guide you through which is the best surgical procedure for you. But there are two main aspects of bariatric surgery. One is a reduction in the stomach size. So we get you to take in less calories. And the second component is to have some element of an intestinal bypass so that even the reduced calories coming into the intestine, you do not get any absorption from it. That's a very crude way of looking at bariatric surgery, but certainly these are metabolic procedures. And in doing so, in adjusting anatomy that is actually inherently not abnormal. This is normal anatomy that we are now changing for metabolic benefit. You will get significant metabolic change from that.
Unfortunately, our time has run up quickly. Dr. Ibrahim, your concluding comments, 10 seconds. Final words, please.
Final words is take obesity seriously, talk about it more, create an awareness, and do something about it as soon as possible.
That's where we have to leave it, unfortunately, with Dr. Ibrahim Mansoor, who is currently breaking new ground in South Africa. He is the youngest surgeon offering bariatric surgery, and he has a passion for those that want to lose weight and talk more about this issue. Thank you so much for your time. We appreciate it. All the best. Seems like we're going to have a follow-up. Till we chat again, Dr. Ibrahim, all the best, and assalamu alaikum.
Alaikum salam.
There you have it, Dr. Ibrahim Mansoor. Thank you so much for your time. And also, please do keep your questions, comments, and queries coming on this topic so we can advance and understand it. As he said, it is something that's changing all the time. It is niche obesity. There's maybe a handful of specialists that knows about it and can guide us and help us. But go and see your general practitioner and your dietitian mostly to guide you to make those changes. Let's start today, a little bit at a time. From myself, Gouwah Solomon, hope you enjoyed this edition of Your Health and Wellness Show. Wassalamu alaikum and goodbye for now.